Right. I hope this starts in a minute. 1 second. Right. I hope this starts in a minute. Okay. This is a study on increased risk of attempted and completed suicide in OCD. And it's a systematic review of follow-up studies which have been published in Global Psychiatry Archives. The interesting part is that when I was young and was trained in psychiatry, we knew that obsessive compulsive disorder is a long-term condition, but we always heard from our teachers that there is no increased risk of suicide. So I ventured out to do this study, and it was a systematic review. We were focusing on follow-up studies, and so I tried to keep it short. So we did a literature search, which led to 400 papers, which had the search term OCD and suicide. And so we came up more or less with quite a few studies, 404 papers, 63 non-English, review papers, which we didn't produce new data, case reports. Then some studies only included the search term, but didn't focus on the interaction of OCD and suicide. Some studies only focused on suicide ideation, and some studies, 22 studies reported on suicidal thoughts, but no suicides itself. So we had quite a few papers, which 73, which 42 didn't focus on any OCD and suicidality. They didn't produce any relevant data. And we eventually came up with 6 papers on the issue. The interesting part, again, is that on the long term, so these are studies which focused on suicide, completed suicide, and OCD, and were focusing on follow-up studies. There were studies which looked at specialized clinics. So that was a study by Alonso. There was this long-term follow-up by Jules Angst, who is very interesting and very famous psychiatrist in his 90s now. There are cases with OCD, and he followed up a sample from the army. But as the other special clinics, and so these studies either had the problems that the suicides were very rare, and the only really relevant study is the one by Fernandez, which had looked at the Swedish register. They looked at suicide attempts in OCD versus the general population. They had 37,000 patients with OCD and 387,000 matched controls, which without OCD, and they had a follow-up register for 43 years. And I go back to this outcome of this study, which shows that there was 4,000 suicide attempts, and they found an increased risk of suicide attempts versus with an odds ratio of 9.8 in the OCD population, and they also found increased risk of suicide attempts and completed suicide in OCD even after adjusting for psychiatric comorbidities. So this one is a study which is really the one study that provides the data and provides convincing data, long-term follow-up, decent diagnostic criteria, which shows increased attempts and completed suicide in OCD. You can't blame other people not having found that, because at the end of the day, suicide, luckily, is rare. OCD is rare as well. So you need an awful lot of patients and samples to follow up. And this is luckily available in the Swedish register. Okay, so what we learned from this is that now the conclusion is very clear. that we can provide sufficient evidence that that there is an increased risk of suicide in patients with OCD. This is only available from long-term registers, and the Swedish register was very well appropriate for this type of study. If you want to see this paper on our website, look at www.globalpsychiatry.co.uk, where you find this paper and many other interesting papers. Thanks for your attention, and I hope you can register for or subscribe to our website.